Demodectic mange, sometimes just called Demodex, is the most common form of mange in dogs. It is caused by the Demodectic mange mite, a parasite which lives in the hair follicles of affected dogs. Under the microscope, this mite appears to be shaped like an alligator with 8 legs. Since a few Demodex mites are found on virtually all dogs, exposure of a normal dog to a dog with Demodectic mange is normally not dangerous. The underlying cause of Demodectic mange disease is a defective immune system. The dog's immune response cannot control the Demodectic mange mites like a normal dog, so the mites proliferate rapidly. Demodex infection occurs primarily in young dogs, 3 months to 1 year old. When the disease is seen in older dogs, it is usually because the immune system is weakening. This may be related to age or the presence of a debilitating disease such as cancer. Because immune system development is inherited, a dog with Demodectic mange usually comes from a litter containing other affected puppies. Due to this genetic defect, Demodex-infected dogs should not be allowed to breed. Neutering the pet is a simple solution. Also, the dog's parents should not be bred again. Surprisingly, a dog with Demodectic mange normally does not itch severely early in the disease, even though it loses hair in patches, usually beginning on the face, especially around the eyes. When there are only a few patches of hair loss, it is called localized Demodectic mange. If the disease occurs on many areas of the skin, it is called generalized Demodectic mange. Diagnosis of Demodectic mange is made by examination of material from a skin scraping under a microscope. The skin is pinched, forcing the mites to the surface. The material from the surface is placed on a microscopic slide and examined. Normally, large numbers of mites are found. The localized form of Demodex is usually treated with topical medication and is relatively easy to control. The generalized form of Demodex, which is much more difficult to treat, requires aggressive therapy with oral medication or a special dip. Using a special cleansing shampoo helps to flush the mites out of the hair follicles prior to dipping. Secondary skin infections are common and may require antibiotic therapy. Severe itching and bad skin odor often occur from secondary bacterial infections. Dogs with secondary skin infections sometimes have very red, inflamed skin. For this reason, Demodex has been referred to as red mange. Because the immune system does not mature until 12 to 18 months of age, a dog with Demodectic mange may have relapses until that age. It is important to retreat promptly to minimize complications. Treatment of the localized form of Demodex is generally successful, while the generalized form is a bit more challenging, but it is also usually successful. However, if the immune system is extremely defective or weakened, neither the mange or the infection may respond to treatment, and frequent relapses may occur. Please remember that the generalized form of this skin disease is very serious and often requires lengthy specialized treatment. Home remedies can make the problem worse. It is important to have the disease treated as promptly as possible by a veterinarian. Following prescribed treatment, a dog's hair coat should return to its original thickness and luster.